Hey everyone, welcome back to Analyze with Casey, where we use data to pull back the curtain on healthcare. Today, we're diving into something deadly serious: preventable harm in healthcare. These aren't just isolated incidents, they're widespread, documented, and disturbingly common. And if you care about fairness, quality care, and saving lives, this is exactly why DEI isn't optional, it's essential. Let's look at 10 recent stats that prove it. If you haven't seen the first 5 stats in this series, go check that video out. We covered racial bias, algorithmic harm, pain disparities, and representation gaps that are still costing lives today. This is part 2. We're picking up right where we left off, with more data, more urgency, and more proof that DEI isn't optional. Stat 6. Nearly 800,000 Americans suffer permanent disability or die every year because of misdiagnosis. That's more than the population of Washington, D.C. That's according to a 2023 study by Johns Hopkins and the Agency for Healthcare Research and Quality. These aren't rare diseases. They're strokes, infections, and cancers, missed. And it happens more often to women and people of color. This is precisely why DEI matters. Because if you're not seen or heard, you're more likely to be harmed. Stat 7. In 2022, 1 in 3 transgender adults reported being mistreated by a healthcare provider. That's data from the U.S. Trans Survey, the largest survey of trans Americans to date. Mistreatment means denied care, disrespect, or being physically handled differently. This isn't ancient history, it's now. And DEI, it's the difference between safe care and dangerous avoidance. Stat 8. A 2021 study in JAMA Network Open found that Black and Hispanic patients wait longer in emergency rooms, even with the same symptoms. That's not about triage, it's bias baked into the system. And longer waits mean higher risk. DEI isn't just fairness, it's about leveling the playing field when every minute counts. Stat 9. In 2023, a medical guide called Stat Pearls reported that preventable medical errors cost the U.S. more than $20 billion every year. These are mistakes like giving the wrong medication, missing something important on a test, or not catching a serious illness in time. These errors don't just cost money, they cost lives. Stat Pearls says these kinds of mistakes are one of the top causes of death in the country. That alone is serious. But it gets worse when we look at who's being harmed the most. Another article, also from Stat Pearls, looked at how people from different backgrounds are treated in healthcare. It found that discrimination still happens in doctors' offices and hospitals, not always on purpose, but the effects are real. People of color, especially Black and Hispanic patients, often get worse care. They're more likely to be ignored, misdiagnosed, or sent home too early. That means these preventable errors, the ones we just talked about, hit them the hardest. A third study from a journal focused on healthcare fairness pulled all of this together. It found that safety problems happen more often to people from minority groups, and not because of the patients, but because of how the system treats them. So let's be clear, this isn't just about accidents. It's about a system that doesn't treat everyone equally. When people are already struggling to be heard, to be believed, and to be helped, medical errors don't just happen, they multiply. That's why we talk about DEI, which stands for diversity, equity, and inclusion. It's not about politics. It's not about quotas. It's about saving lives by making sure everyone gets good care. When hospitals hire more diverse teams, when doctors are trained to understand different cultures, when we actually listen to patients who've been ignored for too long, errors go down, outcomes go up. So if we want to reduce these deadly mistakes, if we want to save billions of dollars and thousands of lives every year, we need to treat fairness like it's urgent, because it is. That's what DEI is about. And that's why I'll keep saying equity saves lives. In 2024, Word and Black reported that women are 20% more likely to be misdiagnosed than men. And for racial and ethnic minorities, the risk is even higher, up to 30% more likely than white men. These aren't rare diseases. They're common conditions like strokes, infections, and cancers. Misdiagnoses mean delayed treatment and worse outcomes. We don't need better guesses. We need healthcare that listens to everyone equally. That starts with DEI, diversity, equity, and inclusion, to ensure accurate diagnoses for all. Stat 11. In 2023, a study from Johns Hopkins University estimated that diagnostic errors alone contribute to approximately 371,000 deaths and 424,000 permanent disabilities each year in the US. These aren't just numbers, they represent real people affected by preventable mistakes. The consequences are profound, whether it's a misdiagnosis, a communication breakdown, or a system failure. This underscores the critical need for systemic changes in healthcare, including implementing diversity, equity, and inclusion (DEI) initiatives to address and reduce these errors. Stat 12. In 2023, a study published in the Journal of Emergency Medicine analyzed emergency department visits for patients with substance use disorders. The findings revealed that Black patients waited 35% longer to be seen compared to white patients, even after accounting for factors like age, insurance status, and how they arrived at the hospital. This significant delay isn't due to medical reasons, but points towards systemic issues and potential biases in healthcare. For many, the emergency room is the only place to seek help. Delays like this can discourage people from returning, leading to worse health outcomes. Addressing these disparities is crucial. Implementing diversity, equity, and inclusion (DEI) initiatives in healthcare settings can help ensure that all patients receive timely and appropriate care, regardless of their race or background. Stat 13. Cardiovascular disease kills more women than all forms of cancer combined. Nearly 45% of women over age 20 are living with some form of heart disease. And yet, women make up only 38% of participants in heart disease clinical trials. That means nearly half of women are affected. But their symptoms, risks, and needs aren't being studied or prioritized the same way. Add to that, more than half of deaths from high blood pressure are in women. This isn't just a gap in research, it's a gap in care, and it's costing lives. Stat 14. A major national study found that even when children came to the emergency room with appendicitis, a life-threatening emergency, Black children were 5 times less likely to get strong pain medicine compared to white children. Across all kids, pain treatment was bad. Only about 57% of children got any pain relief at all. But when it came to the best painkillers, opioids, the gap was shocking. After adjusting for pain scores, how sick the kids looked, and other factors, Black children still had only 1/5 the odds of getting opioid pain medicine compared to white children. Same diagnosis, same severe pain, but much worse care, based only on the color of their skin. Researchers believe part of the reason is bias, unconscious stereotypes about who deserves stronger medicine, even when the pain is the same. And here's the kicker. These disparities didn't improve over time, even after pain management became a quality measure in hospitals. This isn't just unfair, it's dangerous. Pain is real. It shouldn't take the right skin color to get treated for it. Stat 15. In 2023, a major national survey found that almost 1 in 3 Americans said they skipped medical care because they couldn't afford it. That's nearly 100 million people who didn't go to the doctor, didn't fill a prescription, or didn't get care they needed, all because of money. And the numbers are even worse for Black, Hispanic, Native American, and lower income families. Healthcare isn't a luxury, it's life or death. If we don't fix these gaps, millions will keep suffering in silence, and DEI is part of how we start changing that. I want to take a second and explain why I keep sharing these stats. It's not just data, it's people's lives. When I talk about DEI, diversity, equity, and inclusion, some folks hear that and immediately think I'm talking about affirmative action. But they're not the same thing. Affirmative action is a specific legal policy designed to create opportunities in hiring or school admissions. But DEI is bigger than that. It's a framework, a value system, a commitment to making sure everyone has access to fair treatment, respect, and care, especially in healthcare. DEI means understanding that people of different races, genders, disabilities, languages, or incomes don't always experience the same level of care. And we have the data to prove it. It's not about giving unfair advantage, it's about fixing the disadvantages that already exist. In healthcare, DEI can be the difference between a mom surviving childbirth or not. between a child getting pain relief or being ignored, between a trans adult being treated with respect or being turned away. This isn't politics. It's not a debate. It's about making healthcare actually care. I share these stats not to divide people, but to wake us up. Because if we don't look at the hard truths, we can't fix them. So if you've ever felt dismissed, discriminated against, or like your voice didn't matter in a clinic or hospital, you're not alone and it's not okay. That's why DEI matters. And that's why I'll keep speaking up. DEI is how we make sure discharge actually means healing. These aren't just numbers, they're warning signs, flashing, urgent, and too often ignored. Bias in healthcare doesn't always scream. Sometimes it whispers in delays, misdiagnoses, or assumptions. But the data? It's shouting for change. If you believe care should be safe, fair, and based on truth, not bias, then you're in the right place. For every new subscriber, I drop one more powerful stat. One data point at a time, we're building a library of truth together. I'm Casey, and this is Analyze with Casey, where we use data to expose what's broken and imagine what could be better. Subscribe, share, and let's keep asking better questions and demanding better answers.